Thank you, Madam Chairwoman. The purpose of this hearing today is to discuss Speaker Pelosi's legislation, H.R. 6800, the HEROES Act, a massive, almost 2,000-page bill that surprised not just conservatives, but even the most progressive Democrats. It would federalize local elections, give tax cuts to the rich, pour billions into universities that are already overcharging students, expand Obamacare while banning information about lower-cost health care insurance plans, and prevent the administration from securing our borders and protecting Americans from criminals who come into the country illegally. There are numerous provisions on marijuana, sprawling pension bailouts, and stimulus payments to illegal immigrants. It would make it harder for low-income Americans to get back on their feet after the crisis ends, and it would not include liability protections for employers, hospitals, schools, local and state governments. Companies across the country would go out of business and workers would lose their jobs. This bill would mean economic suicide. The legislation was sprung on Republicans and Democrats with barely any time to read through it and allowed for no bipartisan input. After we had all worked together in a bipartisan fashion and passed at least 4 previous COVID packages. It includes an outrageous number of provisions entirely unrelated to what we should be focused on here in Washington. The American people expect us to first and foremost tackle the coronavirus outbreak, promote first and foremost health and safety, and get Americans back to work and save jobs. Dr. Davis, along with Congressman Davis and Congressman Schrader, I introduced the Bipartisan Health Care Protection Act, which would provide premium assistance so people who lose their jobs can afford to keep their health insurance through COBRA without paying increased premiums. In contrast, the HEROES Act would hurt families by banning information about lower cost coverage options. Professor Davis, how can Congress work to help families continue to access health insurance? Does limiting information about lower cost coverage make sense to you, sir?
Thank you for that question, Member Wagner. No, it does not make sense to me for the reasons you've suggested. But I also want to underscore a very basic point that you also made reference to, which is many Americans, most Americans get their health insurance through their employer. And if we want to make that opportunity available to them under our current system of funding health insurance, then we need to get the economy going. We need to do the kinds of things that I talked about earlier to help businesses grow and to help create more jobs so that people will have health insurance through their employer.
You're right, Dr. Davis, which is why the PPP program was so successful, because the premise was to keep employees attached to their employers. One of my concerns with the HEROES Act is the unrestricted fund for states and local governments with no controls, 0 controls in place over how the money can be used. In addition, I know that many state and local jurisdictions, in fact, sadly, I'm very disappointed that a majority of the CARES money that was sent to St. Louis County has not even been distributed yet. Many of these local jurisdictions have yet, as I said, to distribute the money and give them that was given to them by the CARES Act. And I think we need to be very cautious about not appropriating additional funds in spaces where we haven't used up existing money. Professor Davis, what concerns do you have regarding the over $1 trillion in unrestricted aid to state and local governments in HEROES Act?
Thank you. I think that the basic point that you're underscoring runs across many of the spending programs. If you try to spend too much money too fast without controls, much of the funds will be misallocated or misused. We've seen evidence of that in the PPP program, despite some successes. We've seen evidence of that in the reports of fraud in the unemployment insurance system. And I agree with you. We need to ensure that funds that are allocated to state and local governments are used as intended to deal with the pandemic crisis.
Thank you. I appreciate it. I yield back.